evening. When I was working at MIT in cancer research, I realized that the tools we were using were not being well translated into the clinic. I saw an opportunity to apply genomic innovation to improve the lives of patients. Our team is working together to create the most accurate blood test for liver disease. Harnessing genetic tools, our tests would be more accurate than other alternatives for early detection, intervention, and improved outcomes for patients and their families. Did you know that 1 in 3 Americans, or 100 million people in the United States, have fatty liver? This disease is not associated with alcohol consumption, but rather diabetes, obesity, and metabolic syndrome. It is called non-alcoholic steatohepatitis, or NASH. Many patients are unaware that they have NASH until the disease has progressed to later stages when it is no longer treatable nor reversible. The reason for these trends is that there are 0 effective diagnostic tools that can differentiate the benign from advanced form of NASH. Imaging tools are inaccurate. The sole diagnostic test is a liver biopsy. These are expensive, invasive, prone to sampling error, and bleeding. Therefore, they cannot serve the population at large. At Aged, we are developing the first accurate blood test to differentiate the benign from advanced form of liver disease. Our tools will help hepatologists improve patient outcomes, reduce the financial burden on health insurers, and aid in early detection and intervention. Here's how our technology works. We take a patient blood sample and we isolate very specific biomarkers associated with liver disease as well as liver damage. Then we quantify the concentration of these biomarkers. Past a defined concentration, we can say with a high clinical accuracy that the patient currently has liver disease. The market opportunity is vast and growing. Globally, there are more than 2 billion patients who are considered high risk. Each year, health insurers in the United States spend more than $100 billion on management for liver disease. Age seeks to capture 25% of the US market, which equates to more than a $27 billion yearly market opportunity. There are 0 blood tests for NASH, so our competitive advantage is that we would be the first blood test to diagnose this disease. We'd be less expensive than the gold standard, which is a liver biopsy, as well as all other imaging modalities. And last, but certainly not least, we would be the most accurate diagnostic tool on the market by targeting highly innovative genomic regions, so we expect to be the most accurate tool for decades to come. We've had exciting traction to date. We just completed our first of several pilot studies and identified a set of biomarkers that could differentiate the benign from advanced form of liver disease with nearly 90 to 99% accuracy. We've recently partnered with the Henry Jackson Foundation, which is a subsidiary of the US military. We expect to launch a clinical trial by 2024 with our partner hospitals and launch into the market as a service as a lab-developed test by 2025. We are the team poised to take this technology to market. We have 100 years in hepatology, 75 years in business, 40 years in genetics. We've had 5 exits and secured more than $125 million in funding to date. We expect to launch by 2025. In year 1, we seek to launch as a lab-developed test as a service and be reimbursed at a rate of $700 per patient per tool. In year 1, we seek to capture 0.1% of the US market, service 25,000 patients, and generate $17.5 million in revenue. By year 3, we seek to pursue FDA approval, and by year 5, we plan to exit with some of our current partners. We have previously raised $550,000. We're currently raising $1.75 million to reach several critical business milestones. We're hungry, humble, and yearning for progress. Thank you, and I'll see you at the booth later.